In this video we're going to be talking about the patient exam portion of the Dental ETC software. You will notice that when we select the patient exam area, a row of tabs appears, one for each of the dental modules that are available, representing subject areas within dentistry which we can have exams for with our patients. In this case we have the periodontal tab selected, and you'll notice down the left side, the left column, that there is a column of risk factors and clinical conditions that are listed, each with a correlating clinical condition on the right which is selectable as a result of the exam findings. For example, in the professional care role, if the patient was not regular in attending the dentist, you would select the not regular button. And if their oral hygiene behavior was less than 2 times a day and they didn't floss or brush, you would obviously select those. If they had poor plaque levels and ground their teeth, and they had moderate bleeding upon probing, then you would mark the appropriate areas as you went through the exam. As we go down the list and scroll down, you'll notice that the list continues. At the bottom, you'll notice the AAP case type diagnosis area. In this case, if we just assume this patient is an AAP case type 2, we will select that, and that will come in handy later, as we'll show in a few minutes, in triggering the protocol. When we select the Caries tab, you'll notice that we have a similar layout where the clinical findings or risk factors are lined up on the left side, and in this case we are not going to be filling in clinical conditions to the right, but you'll notice that there is a Caries risk assessment matrix which will help the clinician to choose an appropriate risk category with regards to the caries infection process. At the top you'll notice that we can choose the full CAMBRA or Caries Management by Risk Assessment exam for either age 6 and older or 5 and younger, or we can choose the light caries exam, again for the same age areas. If we scroll down, you'll just again notice that the left side has risk factors and clinical conditions listed there, which we can then evaluate. As we go down this list, you'll notice that what happens on the right is we start to get some help with regards to the risk categories that this would fall into, and all we're doing here is clicking exactly what we see with the patient. As you'll notice, the red is lighting up to the right, and we'll just assume that these are all conditions in our make-believe patient here, but as we scroll back up, you'll notice the red indicators in the appropriate columns here guide the eye of the clinician down to the bottom where we actually make the diagnosis and assign a risk category that is relevant to this patient. Demonstrating with these 2 tabs, the periodontal and caries tabs will give you the typical layout and format again for the rest of the tabs. The whole concept with regard to the patient exam and dental ETC is that it provides the clinician a checklist to thoroughly evaluate all of the clinical risk factors, health history issues, and clinical conditions that they might find. It's important to note that this does not take the place of the practice management software such as Dentrix or Eaglesoft or others. This is summarizing the clinical findings that would have occurred during that exam and reducing them to the dental ETC form, which will then be able to provide the reports and the protocols, as you will see in other videos.